Hey, my friend. Welcome to another episode of the Help Me Understand podcast, where we dig deep to find strategies that work for us to keep us healthy and heal from the chronic disease that plagues this age of modernity. Today, I'm absolutely over the moon to have Dr. Derya on the podcast to talk about one of my favorite subjects, posture. Dr. Derya is a doctor of physical therapy, and she's also certified by the Postural Restoration Institute. This means she's not your typical PT. After years of working in busy clinics and experiencing her own stubborn injuries, Dr. Derya realized something really important. True healing isn't about just managing symptoms. It's about addressing the root cause. This realization led her to the Postural Restoration Institute, where she found a new approach, one that looks at the body as a complete, interconnected system. Rather than focusing on isolated areas of pain, it's about understanding where the body is stuck, where it's lost its natural movement patterns, and how to restore that balance. Dr. Derya's approach is different. It's intentional. It's about uncovering those underlying patterns so that her patients can experience real, lasting change. It's about moving away from symptom management and instead helping the body remember how to move in a way that feels good so you can get back to moving again with comfort and confidence. In this episode, we discuss all aspects of posture, including what posture is, why it's important, and of course, how to fix it. Here's what I want you to pay attention to. First, notice how Dr. Derya talks about posture not as something rigid or forced, but as something fluid and adaptable. It's not about standing or sitting perfectly. It's about finding balance and ease in your body. Second, pay attention to the concept of patterns. Dr. Derya will explain how our bodies often get stuck in habitual movement patterns that can lead to discomfort and pain. Understanding these patterns is key to unlocking better movement. And finally, I want you to listen for the small, actionable tips she shares. Posture isn't fixed overnight, but there are simple shifts you can make starting today to begin restoring your body's natural alignment. All right, let's dive in. Here's my conversation with Dr. Derya. Dr. Derya, it's so fantastic to be here with you today. Thank you so much for carving out the time from your day to have this conversation with me. My first question has to do with when we talk about posture, what exactly are we talking about?
I love that you're leading with that question because when you asked me to do a podcast about posture, I was like, okay, I wonder what she thinks posture is. Because, I'm certified through the Postural Restoration Institute. And whenever I say that, like if I'm having a conversation with somebody, they'll just sit up really straight and say, oh, my posture's so bad. And that's not really the way that I think about posture. It's more that we should be able to move through a series of postures throughout our day and our life, not just one static posture. So it's not just, can you sit up, quote unquote, straight, or can you stand up, quote unquote, straight? Like, what even is that? Nobody just stands perfectly straight with both feet totally flat on the ground as a comfortable position. Like maybe if you're in the military, but that's not how our bodies are designed. Our bodies are designed to alternate and shift around and be in motion. So when I think of posture, what I think about when I look at is, okay, is this person able to comfortably shift into both sides, like posture A and posture B, let's say? Oh, this person is kind of stuck in posture B, and can't really access posture A. How can we help them access posture A? And then, we develop compensations on top of that. Like scoliosis is just someone who's really loved one side for a long time too much, or some other driver put them there. So yeah, what is good posture? What even is posture? It's definitely not static. It's dynamic, and it's, in my mind, like freedom and fluidity and flow in your body. It's kind of a vague answer, but it's not it's not
I
as cut
love
and
it.
dry as I think we want it to be.
I love it. Because when we think about it as a static thing, then the question becomes, okay, well, but I walk and I sit down and I do these other motions that are not just the standing position. So then if posture is a prescription for just a static standing position, then what's the prescription for everything else?
Yeah.
So I'm curious, from your point of view, what it what is the extent of the posture problem that we're having collectively as a society?
Yeah. So I think what you're maybe referring to is like all these people are working from home, working remotely, or like at desk jobs, like more tech, more like sitting. And now there's all these devices coming out and back strap things coming out to help you with your quote posture, right? To quote sit up straight. And I think
Mhm.
I'm trying to think of how I can say this in a way that's like easy to understand without any visuals. But essentially, when we are worried about our posture, it's usually that kind of forward shoulder, forward head, slumped ish position, right? Everything's coming forward. Um, and I'll just say,
Mhm.
from a PRI standpoint, if you cannot shift side to side, you're just going to start, everything's going to start coming together and converging and going forwards. Our visual system, like 30% of our brain is dedicated to vision and visual processing. So it's not just, oh, can I see clearly? It's, okay, if I go to walk out my door, I'm not going to just keep walking until I hit the door and then I know I'm at the door. I start to slow down as I get closer to the door. I start reaching for the door handle. All that is unconscious information from our visual system telling us how to posture ourselves and move our body with zero of consciousness of that. So, like, for example, if I had you stand up and stand on one foot right now, you'd be like, okay, most people can probably do that. But if I had you close your eyes, it would feel really wobbly. But when your eyes were open, you weren't saying, oh, okay, I should really like use my eyes to balance myself. It's just unconsciously happening all the time.
Mhm.
And so now our visual system, if you think of a very primal human, like out, surviving on the land, like foraging for berries and hunting for their food, I need to be able to see a large amount of periphery um, with my eyes to know where my potential food is coming from or where potential danger is coming from, right? So I rely on that periphery, and I need my body, my brain is not going to allow my body to move into space that I can't visually assess for danger, right? At a very primal level, right? This is just how a nervous system works. If you can't see what's there, your brain is not going to put your body there, right? Survival. Okay. So we rely
Mhm.
on that periphery to be able to shift side to side, to feel safe in our body, and to have that alternation expansion. Okay. So now I take you and I put you in front of a screen for 8 hours a day, where now your visual field is very narrow. You have zero awareness of your periphery. Okay. So you've stopped shifting side to side. Your visual system has started to converge, and your body will follow that and start to converge. And just as I mentioned earlier, everything starts to come forward. And you're probably going to pick a side because you're no longer shifting side to side. And most people are going to pick their right side. And we can talk about why that is later or now, or if you want. Um,
Mhm.
but that is a huge piece of why people are getting stuck in this bad posture. And then our generations of kids now are more and more myopic, meaning more of them are needing glasses. That myopic vision is because they're growing up on these screens, right? Their eyeballs are literally changing to accommodate to a closer world versus a larger world. And that's pulling their bodies forward. Now they're growing up with that forward. Okay, so the visual system is like one piece. And then all those posture correcting things where it's like pull your shoulders back, or, oh, it's going to buzz you every time you've dropped your shoulders. Well, have you ever met anyone where they're like, oh, I just like pulled my shoulders back all the time and now I have great posture, right? Usually they're like, now I have all different kinds of pain, or that was just like completely unsustainable for me. And the reason for that is the posture of that coming forward. It's not really a shoulder issue. It's like we've stopped alternating and expanding. So we've stopped using a compression decompression approach to how we position our thoracic diaphragm, or basically our breathing diaphragm. And we've sort of started to pull up our ribs in such a way that we need to pull our shoulders forward to counterbalance that. Now we're just kind of stuck here, right? So in order to restore your shoulder position, your neck position, you need to start with the base, which is like your diaphragm and your rib cage. So that was probably more of an explanation than you wanted. And honestly, I could probably talk about that for a whole hour, but I'll just stop because it's a lot.
Love it. I want to go into every
There
rabbit
was a
hole that
lot
you
of
just
rabbit holes.
opened up here.
I can't not rabbit hole.
I mean, it's hard to not geek out on this stuff, like truly, because I'm with you 100% on the sort of Band-Aid solutions that we oftentimes see, or anytime I hear or see somebody out in the wild say, stand up straight, I see them sort of exacerbating issues that were already there, like what you're talking about, of like the rib cage kind of arched back and then your shoulders kind of stuck forward. And so we're not actually getting at what we're attempting to get at with the cue of like stand up straight or put your shoulders
exactly.
back. And what I hear you saying is that the downstream of that, where all of that starts, is we're not able to shift side to side. That's actually where the root of our problem is. And so now we need to go look more at that.
Yeah, I would say that's actually a really good summary. I think the shifting side to side is hard for people to grasp, because it's like, well, I just need to get my shoulders back. It feels like a front to back thing. But think of side to side as expansion, right? You can go into one side, your world opens that way, and then you can go to the other side, your world opens that way. So you sort of have this freedom of expansion and like compression, decompression, and alternation, which is freedom, fluidity, and flow in a system. That's what our body likes. That's what our nervous system likes. So now you're seeing all these people who are on screens, like anxious generation, all that stuff. Well, their body, their nervous system, via what it's sensing through their body, is in a state of enormous tension. So you can do as much, meditation or relaxation exercises, all that. But if that body is in a state of compression or convergence, let's say, or it can only compress on one side, can only decompress on the other side, there's no alternation, that system is in a state of anxiety. I mean, I'm not a psychotherapist. I don't pretend to be, but I know if that thoracic spine can not get in a good position with your rib cage, guess where all your sympathetic nerve ganglia live? Like in your thoracic spine. So that zone is always being compressed because those ribs are being pushed up and the shoulders forward. Doesn't matter how much you try to relax, you're not going to be able to relax because that you're structurally in a state of anxiety in your posture. Does that make sense?
100%. And so what does being able to shift side to side mean, as opposed to, then you kind of said the alternate is like we converge. So we kind of, our center of mass moves more forward is how I'm
Well,
understanding that. Please
so
correct
yeah,
my
so that's
understanding
one
on that.
way that we cannot alternate, right? You can pick a side,
Okay.
right? And that's when we start to see, I would say, the beginnings of scoliosis or full blown scoliosis, or the beginnings of Parkinson's, right? Parkinsonism um, is the brain's inability to alternate and oscillate. And with people with Parkinson's, we see lack of right apical chest wall expansion. We see lack of right arm swing. We see an inability to center their mass over the left leg. And so it's all just a progressed inability to alternate, right? So you could argue, like, I mean, it sounds scary to say, and I don't mean to scare anybody, but it's like, if you can't alternate, you're kind of pre-Parkinson's or pre-scoliosis. Like, not you're guaranteed to get that, but maybe if you had some like
Sure.
genetic predisposition and now you've lost your alternation, like, yeah, you're heading down that road in like 50, 60 years, whatever. So your question was, okay, are we going towards convergence? That's one way that we can not alternate. But our bodies are really creative, and people have had injuries or things done to them. Like, I could go into that, but all these ways that we modify our bodies intentionally or unintentionally affect us and push us around in certain ways and limit us in other ways. And so we just want to be conscious of that when we're quote unquote diagnosing a pattern. So I'd say convergence is one way. And because we were kind of talking about like the computer desk posture, that is what we see a lot, but there are lots of other ways too.
I see. So when you say convergence, are you mostly meaning the slumped
Yeah, a
shoulders?
converged posture is usually that like everything's kind of coming to the center. So the head is going forward, the shoulders are coming together, the chest
Okay.
appears dropped when really it's like those lower ribs are up and the upper ribs can't expand. And so
Right.
that is, kind of what
Yes.
people think of as quote bad posture. But if you go out and watch people, you'll see that most people, and again, there's lots of ways that we compensate, but most people will have a right shoulder that's more dropped and their right arm won't move as much because that's the most common human pattern. Um, and it depends.
Why
Okay, yeah,
is
so let's
that?
get into that. So this is like
Yeah,
the sort of
I'd love
PRI
to.
flagship, I would say, conversation that okay, I should preface this with, before I was a PRI person, I was like the most annoying like clinician because when I went to school, I was like, I'm going to do research and save the world. And then when I got out of school, I was like, everything is like really evidence based. And like, if I saw somebody doing anything different, I was like, well, this isn't what I learned in school. And this isn't like, where's the research to back this up? There is a ton of research in PRI, but it's a different way of thinking. So it takes a while to build a body of research. So they're starting to put out papers. Um, but the way that PRI is different is it will pull from like dental manuals, like respiratory manuals, like, osteopathic manuals. And it's this theoretical model based on like anatomy and neurology and how humans work. And then, research from a lot of different zones to help solidify and guide this treatment approach. So I get a lot of guff like on Instagram. People are like, where's the meta analysis? And I'll just say, like, I'm with you. Like, most people, like, when you're treating the general population, like, yes, go look at a meta analysis. And I've even looked at some meta analyses where I'm like, this is pretty flawed the way that they looked at this. Like, if you go and read all the studies they chose, what they're concluding is actually different. So if you're going to be really behind a study, please read the study and look at what they did. But yeah, I think, looking at larger scale studies are a good way to um, direct your treatment. And I still look at the research, but I'd say not everybody in that study gets better. And not everybody in that meta analysis gets better. And these people who have other things going on that don't fall in that orthopedic realm usually have other systems involved: visual systems, occlusal systems, respiratory systems, patterns, right? And so the way I ended up just seeing like these more challenging cases, I found that PRI is like sound in its logic, it's sound in its research, it's sound with its way you apply it, which is a test retest model. So instead of just going off a paper and randomly treating, every intervention you give a patient, you're saying like, okay, test, intervene, retest. Did that change you? Was it positive? Okay, let's do that. Or didn't change, let's not do that. Wasn't positive change, let's not do that. So it is really scientific. It's just, it doesn't feel that way because it's not like in the realm of bones and muscles and joints, which is what we're used to in the PT world. And the reason I preface it like that is when I start to say like we're different right to left, people get really upset. I don't know why. It's just not the way we were taught, and it upsets people. So I'm sorry for that, but it's the truth. Like if you look at somebody from the outside, you're like, oh yeah, they're totally symmetrical. But if you cut yourself open on the inside, please don't do that. But if you picture like taking off the front side of a body, you have a liver on one side, you have a heart on the other side. Your organs are very asymmetrical. If you look at the structure of a brain, like one cortex is slightly shifted forward compared to the other. The functioning areas of your brain are different right to left. You have speech and language centers on the left side of your brain, and you have other centers on the opposite side that do completely different things. So let's just accept, okay, we're asymmetrical. If we can just accept that, it will make understanding all of this a lot easier. The big driver of posture at the basic level is your diaphragm. Okay, your diaphragm is this huge muscle. I think people don't understand how big it is. It's enormous. Like go look at a picture of one. There's all these cool people doing what's it called? Like interactive graphics where you can see it moving. It's enormous. Okay, it's powerful and it's very different right to left. And it interconnects with a lot of muscles in your thorax and neck and your abdomen and even like down into your legs via psoas. So the right diaphragm, it's more dome shaped. It's got a big liver underneath it, which helps it maintain its dome shape. On the left side, the right side also has lower attachments on the spine. So if you look at just the anatomy of a diaphragm, it's going to attach lower. So it's just got more structural like integrity to just be a diaphragm, right? The left diaphragm, let's call it a leaflet. So there's the left leaflet and the right leaflet. The left side is flatter, it's smaller and thinner, and it has this huge pericardial sac, which encases your heart, sitting on top of it, right? So instead of support underneath, now it's being pushed down on top. And to make space for your heart, your lung on the left side only has 2 lobes. Your right side has 3 lobes, okay? So this positions the right diaphragm to be more domed and the right lung and diaphragm to be more empowered respiratory muscles, breathing muscles. The left side is at higher risk of becoming a postural muscle, meaning that diaphragm isn't going to be able to dome up and keep its shape as well to pump air in and out. And so it can start to flatten out, and which keeps that left rib cage open so you can get a little more air in on that side, but now it's not really functioning as well. The reason we center our mass over the right leg is our brain and our body really like that nice stable dome shape, because the diaphragm is going to directly influence what the pelvic diaphragm is doing, your pelvic floor. Okay, so those two work together. It's a closed system. When your diaphragm ascends, the pelvic floor on that side ascends, and vice versa, because it's just squishy guts in between. It's a closed system. So your brain says, oh, if I can get over on this right side, I have these 2 nice domes. This feels really stable and supportive to me. I can get my hip in the right position. I can get that hip under me. I can really compress. When we shift into a side, we're supposed to be able to compress. And then if you start to lose that ability to compress on the left side, which is easy to lose because of what I just described, your brain says, this doesn't feel as stable and secure. I'm not really getting that nice dome shape. I'm not really getting compression. So I can't even really shift my mass over there without compression. So that's how we kind of are wired to get a little stuck on the right. Now, this is not a bad thing, because it sets us up for alternation, right? It's going to push you over to your right leg. You're going to counter rotate your trunk to the left, and then you should be able to compress the left, get onto your left leg, and counter rotate to the right. If we didn't have this asymmetry, we'd be these weird Lego people where we just, wouldn't rotate at all. So if you're a wild human living out in the wild, enjoying your periphery, like, moving all different ways, crawling, climbing, you're going to keep both sides. But now I put you in a room that's essentially a box with 4 square walls that makes no sense to your brain on a totally flat floor. I don't care if it's carpet, it's just the same. It's giving you no information. You're going to start to pick a side because you're not getting any information from your environment. And I mean, how many times you're a yoga person, so you're probably not in this camp, but how many times do you put your arms overhead during the day? Like almost never, right? We're just these little, like, unmoving, compressed beings, and we wonder why we get patterned because your brain's trying to hold you upright with very little information. And yeah, so that's kind of the long way of saying it's our diaphragm.
I love it. It makes so much sense to me that we're seemingly symmetrical, but then you dig under the surface a little bit and you realize, actually, no, we're not. And the fact that we're not means that we are set up to alternate one side to the other, as you point out. And being center of mass over the right side is not in and of itself problematic. It's only problematic because we get stuck there. Jeez Louise. So when you start to work with somebody, I guess I'm trying to frame this question. Okay, so somebody has a posture problem. What does that mean? Why is it problematic for us to get stuck on what side or converge or whatever the compensation that our body has had from all the wear and tear and our genetics and all of that? Now we're stuck a little bit. Why is that a problem?
Well, it's a problem for the reasons we discussed previously, for the effect it's having on your nervous system, right? And your ability to shift into both sides. If you can no longer get onto your left leg, guess what? You're still going to have to go places. So you're going to figure out a workaround for that, right? You're going to start doing some sort of compensation that at the most basic level, like, it's probably not going to feel good after a while. Something's probably going to start to hurt. You're going to develop pelvic floor issues. You're going to get asthma. You're going to have hip pain. You're going to have shoulder pain. You're going to have neck pain, right? So a lot of these patients that we end up seeing as PRI providers have been to all the people, right, and not had good results because they were kind of spot treating. Like the way I was taught in PT school, and no bashing on physical therapy. Like, I love physical therapy. I refer to physical therapy all the time. I'm a physical therapist, but it's the pattern. If it gets missed, you aren't really getting to the root of the problem, right? The root of the problem is that you can't get out of one side. You can't get into the other side, or, you can't get out of one position. You can't get into the other position. So you're compensating because you still need to do stuff. You're not just going to sit in a box and not move. Or maybe some people end up there, right? Because they're in so much pain. So that's one thing. We think about dysautonomia, like POTS and those other syndromes that are basically when a doctor prescribes you with that, and they're like, well, that's weird. We don't really know what causes it, but we know your nervous system is a little out of whack. From a PRI lens, a nervous system needs to alternate and reciprocate and sense the floor and sense your sit bones and sense expansion and compression. So if we can restore balance to a nervous system structurally, with restoring alternation, with restoring sense, with restoring reference centers, which is just a fancy way of saying, can you feel all the areas in your body you need to feel? Those patients improve a lot, right? So I'd say a lot of things can go wrong, and I've kind of seen the gamut, like things that have really surprised me over the years where, I started out just treating pain and now I'm seeing all kinds of things. And it's really interesting to see how patterning affects so many realms of our lives that sometimes we're not even aware of.
Wow. I'm so glad you actually brought up that whole evidence-based quandary that it seems to be in. Um, the the level of practitioner I am in this space is I don't personally follow the research. I follow people who follow the research. And I've noticed almost all of these comment sections are filled with these alternating views of, on the one side, posture is creating all of your pain, and then on the other side, there's that's posture's creating none of your pain. We don't have the evidence to support that. Posture doesn't
Okay, well,
cause
let
pain.
me comment on that before you ask the question.
Please do. I would love you to just
Okay,
set the record
so
straight in this regard.
I've read all the studies that they're referring to, because there's some studies came out that people who are evangelists of like just get stronger, that's all you need to do. They kind of pushed out like posture doesn't matter. Please stop saying that posture matters because it hurts people because they think their posture matters and it doesn't. Okay, so the way that study was done, they did not take into account like rib cage position or pelvis position. It was like, do you sit up straight or do you slump? And they were like, turns out, doesn't matter if you sit up straight or you slump, like you're still going to have pain or not have pain. And I agree with that. And that's what I said in the beginning is posture is not static, right? And if people have been told to sit up straight their whole lives, like probably most kids our generation, someone slapped you between the shoulder blades and told you to sit up straight, that probably made you feel worse. And this
Yes.
study was going under the assumption that like, hey, if you have good posture, like sitting up straight with your shoulder blades back, that should make you feel better. But turns out it doesn't. And from that, they concluded posture doesn't matter, which is what I've been saying the whole time. And now if someone comes to me and, you know, I'm trying to do this on Instagram, so it's like this tiny platform where there's no way I could explain all this. And as you said yourself, all the people who are posting and saying like posture doesn't matter, please stop posting this. I will say 90% of that people saying that did not read the study. They just heard someone else say that on Instagram and now are believing that wholeheartedly. Please go read the studies and make your own decisions. And then I would say, you know, a large amount of people I'm seeing are trying to sit up too straight and they're hurting because of it. So if I can say, hey, could you just, you know, drop your ribs, settle into your pelvis and sit like that instead? And they're like, oh my God, that makes me feel so much better. Am I hurting people by doing that? I don't think so. I'm helping people, in my opinion, my humble opinion. But if you can come back and show me how that hurts people, I would be open to hearing that. But I'm not going to ever do anything that hurts people. My utmost goal is to prevent people from doing things that are going to, you know, put them in a position of something they can never get out of, right? So a lot of people say like, oh, PRI, they're just like these kooky people and doing things and saying things that they shouldn't say. And from my point of view, if these patients never got to PRI, they'd probably be getting surgeries and procedures that don't work and then going getting more surgeries and procedures because that one didn't work. And I feel like it's my responsibility because I have this information that people should know about it, right? Like you don't have to do anything, but if this can prevent you from doing something to your body that you can never go back and change, right? I've seen people who've had like surgeries, like a hip surgery, hip replacements that didn't change their pain at all. And then they started doing PRI and now they're pain free. We could have avoided that surgery. Okay. And I'm not saying that to be like, oh, I'm so great. I'm not that smart. I just happened to stumble into this venture because I found it to be highly effective and I just want to be effective. My goal is to just not have people do things they can't undo. And if that's offensive to people, I'm sorry. But I do feel passionately about that. So that's kind of my stance.
I love it. It almost sounds then like we have a definitional problem. Like the people who are saying posture doesn't matter are conceptualizing it in one way. But meanwhile, what you're talking about is the human body is designed to shift left to right. there's something about the way we're living that is impacting our ability to do that, and it's causing all these downstream consequences, then some people try to come along and correct those downstream consequences, but we're too far downriver at this point. Like, we need to go back upstream to correct the things that we should have had access to this whole time, which is being able to shift left to right and not being stuck.
Yeah. And I definitely don't want to say like, I'm right and they're wrong. Like, that's definitely not what I'm saying. I think you're correct. I think there's a misunderstanding of what we're trying to achieve. And, like I read, I don't know if I should even say this, but what the heck? I saw there was like this study that came out that was like, turns out like stretching doesn't inhibit your muscles and it can actually like help your muscles. Um, and it was a meta-analysis. And so people saw that and just said, oh, okay, great. Stretching's great. Everybody should stretch. And I was like, well, let me look at this study and see which studies were in this meta-analysis. Because a meta-analysis is basically they looked at all the studies on the subject and made a conclusion with certain methods based on all that data, which is a great way to look at what things work best for people, right? Like, we use meta-analyses as a foundation for a lot of treatment and physical therapy because it's the best way. You look at all the research together and then say, what does this all say together? So I love meta-analyses. But to draw that conclusion, I was like, well, most of the studies in here were looking at calf muscles, which tend to be a hypertonic muscle that do benefit from stretching, especially in our society where everyone's kind of more on their toes and extended, right? That's going to put you on your toes. So calf stretching, yeah, I would say you could gather from that meta-analysis, like stretching your calves is generally good. Some people had improved even muscle recruitment. Some people had improved range of motion. Everything was great. And then there were other studies where people were stretching their hamstrings where it was like, okay, range of motion improved, but muscle recruitment went down. Like their functional tests got worse. And a lot of the hamstring studies showed that. And then there was just like other random muscles. And I would say for most of the muscles, except the plantar flexors, which are your calf muscles, the range of motion improved, but the functional outcomes stayed the same or got a little worse for most. So I would say the conclusion you could have made from that meta-analysis is, yeah, stretching improves range of motion most of the time and is really great for plantar flexors for function. But for other muscles, let's use stretching to help range of motion without the assumption that it's going to improve muscle recruitment and function. But people saw that and they said, oh, stretching, everybody should stretch everything. It's fine. And then if I come on and say, hey, could you not stretch your hamstrings because that's functionally inhibiting them, neurologically inhibiting them, and making it harder for you to get a pelvis in a good position. And everyone gets so mad at me. And in the comments, they're like, it's fine to stretch because of this meta-analysis. It just is a little hard for me because did you read the study? Did you look at what studies were in the study? You know what I mean? So it's just like the way our world is set up now, people feel like they can make blanket statements about so many things without having to have a conversation. Like, I am happy to have a conversation with anybody that's open to having a conversation. So yeah, that's my stance.
It's so interesting. With that meta-analysis that you just mentioned, is that where, like, culturally we kind of got this idea that stretching is this magic panacea for things?
Okay.
Is that where it sort of originated?
This is a good question. I don't know who decided it was like the greatest thing in the world to stretch your hamstrings, but someone decided that, and now everyone thinks that you're supposed to stretch your hamstrings.
True, but yes. True that. I mean, I have a hamstring attachment injury for precisely that reason that I got after like 6 years of doing yoga every day.
The popularity of yoga, right? And that's like, I would argue, not every yoga person or every yoga place, but most yoga, the way it's taught, is a lot of overstretching your hamstrings. So why do I care about stretching your hamstrings? Well, to get your rib cage and diaphragm in a good position for, quote, let's say posture, neutral positioning, alternation, your pelvis has to be in a good position. You can't have your pelvis tipped forward and then your rib cage neutral. You'll fall over forwards, or vice versa. If your pelvis is tipped back and your rib cage is up, you're going to fall over backwards. Like, you need your rib cage and pelvis are completely interdependent, and you could throw your neck on there too. Your neck and head are completely interdependent on what your rib cage and pelvis are doing. Your hamstrings are a dynamic stabilizer of your pelvis. Your hamstrings are the information your feet get from the floor, recruit your hamstrings to hold your pelvis in the right position. You know, if you can't get over onto your left leg, the most easiest thing you can go after to get somebody to center their mass over the left is their left hamstring, because it is going to pull that pelvis into a position where you can start to compress on that left side. Okay. So now people are having all these issues, back pain, neck pain, whatever, hip pain. And they're like, I've been stretching my hamstring forever. I don't know why it's not getting better. Because you're turning off that hamstring that you need to dynamically stabilize your pelvis. And here's the thing. If your pelvis is tipped really far forward, and again, people say it doesn't matter if you have an anterior pelvic tilt. It does. If you actually read the study, they didn't look at a lot of things that might matter. Okay. But, if your pelvis is anteriorly tipped, that puts your hamstrings in a lengthened position because of the attachment site. So they feel tight because they're always on stretch. So they're having to work overtime to try and hold you up. So they feel tight. So then you stretch them, which makes them longer, which makes your pelvis go more forward. And then they feel more tight until they snap. Okay. Or until you're just totally lost in space. So once you get your pelvis in a good position, your hamstring repositioned. So myokinematically, the position of your muscle, once it's in its correct position to function, it no longer feels tight because it's at its correct tensegrity or length tension relationship to function as a postural muscle.
Holy
Yeah.
moly smoly. When your muscle is in the correct position, now it doesn't feel tight anymore because it's in the right position to do its job.
It's like, oh, thank you. Now I can just function as a hamstring versus holding on for dear life. Same with pelvic floor. I don't know if you're familiar with pelvic floor therapy, but a lot of that is oh, you have pelvic floor issues because your pelvic floor is too tight. That's what a lot of patients hear, which can be true for some cases. But, the way they're diagnosing this is they're just feeling the muscle internally and saying, oh, yeah, it feels tight. But how are you assessing that? Functionally, do you know if it's descended or ascended? There are ways to assess for that. But if you're just making the assumption, usually it's tight because it's hanging on for dear life, over lengthened, right? So, and you're trying to get this person to release their pelvic floor because you felt like it was too tight. Maybe it was tight because it was over lengthened. And what they really need is to be able to ascend that pelvic floor, right? Which would mean getting your diaphragm to ascend, your thoracic diaphragm to ascend. So it's all sort of interconnected in that way. And again, I feel like I'm coming across like I'm bashing everybody. I love pelvic floor therapy. I feel like they really help people. I send a lot of people to them. It's just it can be confusing sometimes for patients and for when we're trying to understand as PTs and other practitioners, how does a pelvic diaphragm really work? And things can be super tight when they're at their max length, literally hanging on for dear life.
Yes, that makes complete sense. I love that. Okay, so we talked about the diaphragm and then we talked about the pelvis being anteriorly tilted, which is my project for life because that is where my pelvis is stuck. And I've taken some pictures of myself straight on and sort of dissected the lines and started noticing it seems like my pelvis is stuck anteriorly tilted, rotated to the right. I say that because when I just am standing neutrally or just however my body wants to stand and I look down at my feet, I can see more of my right foot than I can of my left. So it feels like my pelvis is turned a little bit. And then it feels like it's tipped a little bit where my left side is higher and my left shoulder is lower. And I notice I'll just be on a Zoom call with my team and I'll just catch myself and it will be almost this obvious of what I'm showing right now. So I know there's some like rib cage rotation there. When I'm doing my practice, I've started to get more nuanced about right and left sides. And I notice how my left side wants to offload work to my right side, like is in plank poses or weight bearing or something like that. It's like my whole left arm just doesn't know really what its job is supposed to be. So I'm just kind of peeling back the curtain a little bit so you can see where I'm sort of at personally with my posture restoration. And I'm wondering, after hearing this, like, is there an order of operation to going about fixing your posture, like an order that you always take people through, or an order that you take people with certain patterns through? And there's like different patterns that you've recognized that people
and
have?
no. So I was just talking with one of my colleagues on Sunday, so 2 days ago, and it is kind of like the more you know, the harder it gets, because when you first learn PRI, it's like, here's, if they have this, then this. And then you start to know more and more and more. And you're like, oh, there are all these layers, and I could go here, 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 here. So it's a little more complicated. And it's like some people aren't ready to talk about, like, oh, my glasses might be affecting my posture, so you got to kind of start somewhere else. But yeah, so I will say, a couple things for you personally. I think it is like, helpful and interesting to look at, okay, where do I end up? And oh, I do really prefer this side. And just know, like, just because we prefer to center our mass on the right leg doesn't mean it's necessarily stronger. Okay. So I think that's an assumption that people make, like, oh, my right side is strong, my left side is weak because of a pattern. Your right side is really strong in stance/compression. Your left side is really strong in swing/decompression. So, and another thing, just like side note, when we usually see the right shoulder lower in a right stance position. So when we see the left shoulder higher, that usually indicates that you have some like cranial involvement, so like occlusal or visual or something. So I don't know if that resonates with you. And it could just be something with your upper ribs as well. But that is kind of atypical. So that might be fun for us to talk about, just you and I later, if you want to.
Totally. Yeah.
And so, but yes, there is like at the most basic level of PRI an order of operations. So we think of it in planes. And every motion we do is in 3 planes. I mean, there's like a bajillion planes, but you can break it down to simplify it to 3 planes. Okay. And just keep in mind, as a side note, like whenever we're doing any kind of movement in PRI, there's a little bit of every plane in there. There's no true, just like sagittal plane, but that's kind of where you can start. So for example, sagittal plane is front to back. So like bending forward, bending backwards, ribs coming up, ribs coming down in the front. Okay. Pelvis tipping forward, pelvis tipping back. That is the first plane that you want to get organized. So I can't say I could look at you, but the only way I could really assess is with like some special tests. Okay, what position are you in? Are you truly sagittal or are you one side or the other? So sagittal plane would be like, okay, let's get you out of your anterior tilt. Let's get your ribs down. Let's get you sensing your heels on the ground, sensing your hamstrings, sensing your abdominals as breathing muscles to kind of help those ribs come down in the front, sensing some air into your back, which means now your center of mass is shifted in a position where you can sustain that. Okay. So that would be like phase 1. A lot of people,
Love it.
do a lot better with, or just that will make you feel a ton better for most people in pain. Then would be frontal plane, so side to side, right? So that's where PRI is really, I would say it's like it's quote bread and butter as far as techniques, is like, can you shift into one side? Yeah. Can you shift into the other side? Not so much. How can we help you get that, what we would call left thoracic abduction? So can you get your left lower ribs and left pelvis closer together via your left internal obliques and transverse abdominis, or your left abs? Can you get that left leg under you in the frontal plane with your left inner thigh, or ishiocondylar adductor and your left outer hip, which is your left gluteus medius muscle? So it's like, can we actually get your mass over to the left. That's the frontal plane. And then transverse plane, which is rotation, which is never pure rotation. There's always some frontal and sagittal in there, as I mentioned before, and that's true for all the planes. But that would be, okay, now can you alternate? Can you turn this way, shift into that side, now turn this way, shift into your other side? And those can kind of come before or after each other, depending. But usually that's kind of the progression that we go in from a very basic level. Mm-hmm.
Got it. Okay. Makes sense. And so, like, if someone had their pelvis scooped more underneath them, which I realize is the minority of the population, they're too much in their heels. So they would basically need to do the opposite of the people whose pelvises are tilted forwards, where they need to bring more of their weight into their toe side and find more find more contraction through the abs. Basically, like all of the opposite things that the people with the pelvis tilted forward need to work on.
Not really.
Is that right?
Yeah. So that's like,
Interesting. Okay.
yeah.
Help me understand.
So if you're anteriorly tilted, you need like sensing your heels, your abs, is breathing muscles, yada, yada, yada. Okay. Hamstrings. When you're in that
Yes.
posterior tilt, that's more like that convergence position. Like you basically, if you think of like what your body uses to hold you up, right? You can use like your adductors, your abdominals, your hamstrings, your glutes. And when you've kind of dropped off so many things, you're just kind of hanging on your ligaments. That's kind of that tucked under position. Basically, it's like, and this is like any PT will tell you this, like, your glutes have left the building. They're just not there anymore. So you probably wouldn't work as much with that person on like some of the things that you would with an anterior pelvic tilt person. But you would definitely work on like, okay, can you get your glutes and hamstrings to work in the sagittal plane and the frontal plane and the transverse plane? And usually those people, they're really compressed in their rib cage. So it's like, what can you do to get some expansion and alternation and shifting? And just those people are kind of challenging because they've kind of shut down a lot of things and are literally just hanging. So it's just bringing stuff back online, like it would still be like adductors. Like, can you shift side to side? Can you use your glutes to push you side to side? Can you use your serratus anterior muscles to open up your rib cage side to side? And you would still, they're probably tight in their abdominals. So can you show them how to use their abdominals in a way that's going to be helpful? So it's not that cut and dry as like, if they're this way, you do this, and if they're the other way, you do the opposite. Like even it's sort of like that in the frontal plane where, with our alternating techniques, it's like, okay, once you're at a certain level where you can start shifting side to side, which we have like certain tests that tell us, okay, at what level is this patient, like what sort of techniques will their body be able to accept neurologically? Um, you would try to, you've spent time getting into your left side. Okay, you've worked on that. Now let's try alternating. Hey, can you get into your left side? Now can you go into your right side without getting stuck there and go back to your left side and go back and forth like that? So even the techniques that are alternating, they'll usually have some, not always, but especially the earlier ones, it's like keep that left side abs compressed. Even when you go to your right leg, keep your right arch and big toe on the ground, feel your right glute max when you're on your right side. And then when you're your left side, feel your left glute med and adductor, your left heel to midfoot, right? So you're alternating, but you're still being mindful of, hey, this pattern exists. And we don't want them to get stuck back in there as they start to restore alternation. Does that make sense?
Mm. Yes, 100%. You mentioned that the PRI approach is like there's like test and a retest component to it. What does the PRI intervention look like
So
typically?
it's different in that it's a very, um, it's focused on the patient having control over their own body. Because a lot of other modalities and treatments, it's like, you come to me, I'll dry needle you once a week for the rest of your life. That's a great business model for me, and you're probably going to feel okay, right?
Right.
And so a lot of people, that's like kind of where they're at. They're like, this is all I can do right now. This is just what I want right now. Those people are not going to do well with PRI. But the people that end up in my clinic are the people who are like, I just am sick of feeling like this. I want to know what I can do. Because the interventions we give are techniques that you are using to neurologically put yourself in a different position to make your brain go, oh my God, there is this whole side over here. Or, oh, this is how you feel your hamstrings. This is how you use your diaphragm. So when I see a patient, you know, when I was working at a busy PT clinic, it was like, okay, you're going to come 3 times a week for 8 weeks. Um, and now working with PRI, I'm like, okay, you're going to come every other week for 5 visits, because that 2 weeks in between, you're just working on this on your own, right? So it would be like some techniques to work on based on our testing, then come back. Hopefully your testing is improved, because you've been doing your techniques. Then you get the next progression until you're upright, alternating, go take over the world, right? Um, Obviously, there's other layers to that and other complexities. But yeah, I think it's a very, I like it because I like answers. I want to know why. Like, I remember when I was first practicing as a PT, I mean, I think you get into things because they help you. And like, I had a lot of issues that nothing else resolved for me except PRI. So I was like, okay, fine, I guess I'll learn this. And here I am, 7 years later. But, we were kind of when you're in a clinic, you kind of do assessments on each other and like practice things on each other. And someone was looking at my hip rotation. He was like, your hips go exactly far one way as they don't go the other way on both sides. So I was like, well, why is that? And he was like, well, I don't know. And we're just like, moved on. Right. But I was always like, but why? Why would they be exactly limited on my
Yeah.
left hip into ER, or my right hip into ER as my left hip is into IR? And then comes PRI and it's like, oh, because your pelvis is oriented to the right. And it's like, duh, but that it's like we're not thinking about that. And then it's like the thing with PRI is because it's looking at all systems, you can just keep going down that rabbit hole. And there's always going to be a why, like, why is so-and-so doing this? And why is this? And why is that? Why is this? And you can just take it like so many levels deeper, which is why I enjoy it. But it's not for everybody. Like, I was treating my husband for his knee. I don't think he'll mind me saying this. And, I love him. He's my husband. But I was trying to explain to him something. I'm like, oh, you need to feel your like right heel when you start off running or whatever. And he's like going into the why. And he's like, I don't want to know the why. I just want to know. He's like, I'll do all your kooky PRI stuff because it worked, but I don't want to know how it works. Just tell me what to do. And so I was like, okay, I appreciate that, because not everyone is like that. And some people want to just know what to do. That's going to make them feel better. And so, we can do it that way too. But I find that, again, most of the people who end up in the PRI route, they got here because they were questioners and they said, well, I feel like there's something more going on here, than just like a tendonitis, or like, why does this tendonitis keep coming back? And why do I have to keep getting it dry needled or shock waved or whatever for like perpetuity? It's just, could you address, again, it's like a tendon is just like a muscle. If it's in a torqued position because of your position of the bones around and muscles around it, it's going to constantly be on strain. Once you take that torque off by repositioning, now you don't have pain anymore, right? So, but that's only something that you can do for yourself. I can't tell your brain how to move your body differently. You just learn that. Does that make sense?
Mhm. And so PRI must be more effective at restoring the movement that that our bodies are capable of making than if I were to just take my body into a strength training practice or a Zumba class every week. What is it about it that makes it more effective than just going and picking up weights and trying to weight lift my way out of my
Okay, so I
posture
will preface
habits.
that with like yes and no, right? So I would say like most
Okay.
people, if you're just like a little patterned, which everyone is a little bit because that's how we're designed, but you're not like having a ton of issues, going in strength training and moving your body in all different ways on both sides is like great. It just, but if
Great.
you're, just think about like being mindful of like having three planes in there, like sagittal, frontal, transverse. Because if you go in the gym and you just do like deadlifts and like power lifts and squats, you just did a bunch of sagittal plane work. Congratulations, you just put yourself into like a anterior pelvic tilt position and strengthen yourself there for like an hour and then left. That's probably not going to be great. But if you're doing like truly dynamic, like a bunch of different movements and you're putting some rotation in there and you're keeping your ribs in a good position, like, I mean, even if you're not aware of all that, but you're just moving your body more than you usually would, I think that helps a lot of people. Right. And I think that is better than not
Mm-hmm.
doing that. Same with Zumba, right?
Yeah.
Rhythm has a lot to do with promoting our alternation and having two sides. So put on music, move your body around, please go do that, right? And that is going to help a lot of people.
Love it.
Like go do Zumba. That's amazing, right? Some people will continue to struggle because they are more patterned to the point where they can't really get out of that for whatever reason. Those people would need to come see a PRI provider. So it's not like, oh, everybody just needs to go do PRI. No, it's like a lot of people will get better with just regular PT. A lot of people will get better with just going to the gym and lifting weights. A lot of people get better when they start doing a Zumba class. Like that, those are really great interventions. Please do those things. If you're at a place where you've sort of tried a lot of things, you're not being successful, you're having multiple areas in your body that hurt, it feels like you're sort of stuck, right? Whatever, I think when people need PRI, they know they need PRI. It's just, and the
Mm-hmm.
reason that we can be helpful is we can be more specific, right? We can say, okay, in this plane, whatever, you're limited. And these are the specific zones. Like I think of this was someone else in the PRI world gave me this analogy, but it's really helpful. Like if you think of yourself as a little snowman and your pelvis is the bottom snowball and your rib cage is the middle snowball and your head is the top snowball, all those snowballs need to be able to turn and bend and flex in different directions and separate of each other. So, as a PRI provider, I could be like, oh, it's your middle snowball that's out of whack, that's throwing off all the other snowballs. Right. And then we can work on that versus you just trying to like do everything. Like, if your neck always feels tight and you're always stretching your neck and you've been doing that for a year and it still feels tight, maybe let's look at your rib cage position and you get that reposition. You're like, oh, my neck doesn't feel tight anymore. Great. Right. So that's how I think PRI is more helpful than some other modalities because we're assessing the whole system and getting specific. That I think is what really gets people better in this world, in PRI world. I mean,
Thank you for clarifying that. Yeah, that makes sense. Like go do the things that are fun for you to do, that you're interested in doing, and you'll know that you have a more significant problem if you're getting yourself injured or little aches and pains are creeping up and you can't figure out how to solve them with the movement modalities that you know and
yeah.
love.
And it's just, yeah, if you're like just not getting a good result, like, people will often come see me and sometimes I'll just say, a lot of them by the time they get to me, they've seen a lot of people and like not been successful, which, I then I can kind of say like, okay, we're PRI's like later down the line usually. I mean, I kind of wish it wasn't that way in some worlds. Like I think if, when we're coaching kids in school, for example, or I mean in sports, right? Could we just be aware like, hey, there's two sides to this. And if you're just training this volleyball player to hit over and over again on the same side, like they're going to get really patterned. So could we just go like walk down the stairs backwards after practice or to just get them alternating or something? That's what I would like to see. Um, just a little more awareness. So like put me out of business, right? Because I'm seeing people when they're just like kind of wrecked and it's been 10 years of just being stuck in a pattern because they got really patterned playing volleyball as a teenager. You know what I mean? So, so yeah. And I think like for activities that are like very alternating in nature, like runners, right? Running, especially when you're on a road, it's an alternating reciprocal activity. So if you had like a little bit of an imbalance and now you're doing that same motion over and 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 over, that smaller imbalance is going to make itself more well known and probably a little more pattern because your brain's like, oh crap, they want me to do this thing over and over. I better lean into the side where I'm stronger. You know, those kind of people really benefit from PRI. I would humbly say, I think PRI could be a little more effective in treating those people than traditional modes of physical therapy in which I was trained. And there are a lot of amazing physical therapists out there who know more than about traditional PT than I do. So I wouldn't say that exclusively, but in my experience working as a PT, I was basically like before PRI, I was like, this is not the job for me. Like, I hate this. I am going to learn like web design and quit. I was like, I'm done because I didn't feel like I was doing anything. I was just like spot treating, I was like, oh, your ankle hurts. Let me mobilize your ankle. Okay, it feels better. And then it comes back. Some people would get better, but I'd say the majority of the time I didn't feel like I was like getting to anything. I was just kind of like guessing a lot, which is sad to say because I have my doctorate, right? And I'm like, I feel like I should be able to figure this out. There just wasn't a system that made everything make sense. And then because I had a pretty severe head injury. I broke a bunch of bones in my face. And I saw, because I was in the PT world, I saw like all the best PTs, like saw all the people, craniosacral, osteopathy, everything. And nothing really helped me. And I was like really struggling, like really bad. And I remembered when I did my first clinical rotation, when I was in my physical therapy program, it was in Alamosa, Colorado, which is the middle of nowhere. My instructor was a PRI person. And he was so wonderful because I was like, this isn't what we learned in school. Yeah, like, this is not what's going to be on my test. But he was so patient with me. And he was like, here's the PEC pattern underlying every PEC is a left AIC pattern. He'd be like, just look at the skeleton. I'd be like, okay, I guess this is kind of interesting, but this isn't what's on my test. So I don't care. Again, I was like really annoying. I still am really annoying, but I'm annoying in different ways now. But he was so patient. And, all the other clinicians were like, this tough patient, we don't know what to do. Go see Josh. And he would get them better doing these weird PRI things. And I was like, okay, well, that was weird. Glad that's over with. And then once I didn't think about it again. And then when I graduated, I was like, oh crap. I'm seeing these patterns in everybody because he showed me them. Thank goodness for him that he taught me that. But I didn't know what to do about it. And then when I had that head injury, I was like, okay, I'm going to find a PRI person. Again, I'm not that smart. I just happen to have these amazing people in my life who were able to show me some things. And the lady who I saw to treat me, she ended up becoming a mentor of mine. So I was like, what? I want to learn this. This is like amazing because it's the only thing that helped me. And it made sense. And so she was very patient with me and very kind because I was like, this isn't what we learned. And I was like, where's the research? Blah, blah, blah. And she's like, here's the research. It's like, it's all there. Take a class. And so she really mentored me a lot learning PRI. And I'm so grateful for her. And she got me better. It took me a long time. I had to do some interventions with my teeth because my teeth got all moved around with that accident. And so that, again, I am very grateful because you can learn in a PRI course, occlusion, which is your bite, really matters for a lot of reasons. And I was like, okay, but like, how much can it really matter? And then to live that and feel like the havoc it wreaked on my body, and then to get out of that and feel how free I feel now was, again, just like horrible experience, but grateful because this is affecting people all the time. And the sad fact of our healthcare system is that, if I see something that's going on with someone's bite and I go and talk to their dentist, they're going to look at me like I'm crazy because why are you talking to me? I'm the expert here. I mean, that's not how all dentists are, but that's kind of how our
Mm.
healthcare model is set up. Like I'm not a dentist. I don't pretend to be a dentist. I'm only dumb enough to know there's something going on here that I need help with. And thank goodness, again, I found a wonderful dentist here who is open to saying, okay, this may affect the rest of this person's body. Let me see what I can do with my expertise. Like I'm relying on him, right? Same with
Mhm.
optometry. If I go to someone's optometrist and say, I think their vision may be affecting their posture and their posture may be affecting their eye position. Can we do their prescription a little differently? It's like, I would never say it like that because, you have to say it in a way that's being respectful. And I do, again, I don't know optometry. I'm saying, I need your help. Please help me help this person. I can't help but get a little frustrated that that is the case. I feel like us being in our little silos, like physical therapy's over here, and we just do bones and muscles, and please don't talk to me about anything above the neck. And then you have your optometrists who are like, we just do eyes. Please don't talk to me about anything below the eyeball. Oh,
Mhm.
dentist, we just do teeth, maybe a little airway, but I'm just going to pretend that the airway stops here, right? Like it's, and then we wonder why these patients aren't getting better, right? It's like,
Mhm.
you go to a lung specialist, a pulmonologist for this part of your lungs, and then you see an ENT, which is separate doctor for this part of your airway. See a cervical specialist, right? It's just like, how are we not seeing that that's a problem? We can, and we're over here
Mm.
pretending like, oh, vision doesn't affect my posture at all. And when I mention that to people, they're like so shocked, but then you can show them, like, take your glasses off, your neck totally moves, put your glasses on, it's totally locked up, put on these weird other glasses I have. Now everything's unlocked on my hips. And they're just like, wow, that's so weird. I'm like, it's not that weird. If you think like your eyes are over here in another room and your body's over here in this room, yeah, that's weird. But turns out your eyes are attached to the rest of your body and pushing
Right.
you around, just like your teeth are, right? So I forgot what the original question was, and again, I got off
Mhm.
on another tangent. Um, but yeah, I think it's
I
like,
love it.
you know, PRI can be effective because it's it's just saying, hey, can we just look at this human structure as a system of systems? And if one system is out of whack,
Love that.
guess what? Other systems are going to get a little out of whack. And I don't care what like research paper you show me or what research paper you say I don't have, like, you can't deny that that's a fact. Like, you can't just pretend that's not real and get mad that it is real because, and it's, as a PT coming into this world, I was like super skeptical. I was like, blown up balloons is weird, like, why are there kazoos, like, and then it's like, it seems kooky and weird. And I think it's so different than the way we were trained. It feels scary because change is scary and different things are scary. And it's, some of the things are like completely opposite of what I learned in school. Like, and it's
Yeah.
hard to accept that. And it's hard to think about things a different way. So yeah.
Wow. I really want to thank you for your work in this area because I've been following your Instagram account for probably a year at this point, and maybe had seen like some blowing up a balloon and also kind of sitting more in a round posture to kind of fix that anterior tilt and rib flare situation. And these were things that, like, logically on my own, I had sort of been intuiting were helpful for myself personally, but it seems so counterintuitive to the whole posture narrative of sitting up straight, let's say. Like, wow, actually hunching over and trying to get my breath into my low back ribs on both sides is the thing that's going to help
Mhm.
me here. And in order to do that, I need to slump more actually right now. And then I need to try to hold that position in my lower ribs, but sort of free up the ribs above it to stack more vertically on top to give me the up straight image that we're all so
Mhm.
going after. And just seeing your posts have been really helpful in sort of me in my own living room, diagnosing things, rehabilitating a yoga practice that used to look a lot like flow and Ashtanga, and stretching the hamstrings endlessly, and putting myself into more hours of extension than I already was as a habitualized person, and ended up feeling kind of rickety in my skeleton as an impact. So I'm really grateful for your... Alrighty, my friends, that wraps up our episode with Dr. Derya. I hope you learned something new today, and I also hope that you got confused. It would be normal to get confused in a conversation like this, and you don't need to hold yourself to the highest standards of being able to understand everything all in one go. This area is nuanced, it's textured, as you can see, but it's a good area to start getting curious about and interested in. Don't demand from yourself to understand things right away, or to go out and suddenly be moving in completely different ways. Instead, think about this as your opportunity to sit back, to reflect, and to start experiencing your body in a new way, with a new relationship, fresh lens, so that when you get up and you start walking around, oh, what does it mean to shift my center of mass over to one side and then over to the other side? And do I prefer to hang out on a certain side? As you heard in the episode, I am on my left side. That's where I always am. But for most people, they're on their right side. And so, can I start to send my brain down into my body in a different way, where it's collecting different information? And that information actually changes how I move in the world. Please take a chance. Please take a moment to leave a review, or respond to an email that I sent, or find me on social media and send me a DM, because I would love to know what your biggest takeaways from this were. Even if it's just, oh my gosh, my head is swimming in all of this new information. Or maybe it's like, hey, I learned that I don't have to micromanage standing up straight. Isn't that exciting? So do the thing, be in touch. And until next time, be well, my friend. Think about these conversations, and we'll be back here again in a week to learn something new. Thanks for tuning in.